All right, the governor had a busy week this past week. Joining me to discuss it is Matt DeCample. He's a communications director for Arkansas Governor Mike Beebe. Thank you so much for being with us, Matt.
Thanks, Roby.
Let's start first with the budget surplus. This week we learned that the state came in about $145 million over where we expected it to be, about another $45 million from the previous years in the bank. What is the governor's thinking at this time of what to do with this budget surplus?
Well, it will depend a lot on what the budget looks like, or at least the state's finances look like as we get closer to January and closer to the session. But I think everyone agrees the first call on that money is going to be our suspected Medicaid shortfall that we're looking at for the next fiscal year, which is estimated somewhere between $250 to $400 million. Of course, the governor does not like to use one-time money in ongoing needs, but if you're plugging a hole like this, if you've got a short-term fix to help shore up something like Medicaid, he's open to that. And there was a lot of discussion during the fiscal session from the legislature about wanting to do much the same thing. So that looks to be the first call on that money. How much of it? We don't know yet. It'll depend on a number of factors. Of course, you have other things that one-time GIF money is very useful for, the Quick Action Closing Fund being one of them, the governor's favorite tool, I think it's safe to say, for economic development.
Right.
And, of course, other capital needs, higher ed being a primary one, where that's really their only draw to take care of things on campus like fixing roofs and new buildings and things like that.
Obviously, having more money is better than not having enough money. Does the governor also still see an opportunity to finish off the grocery tax, which he's been trying to repeal?
Well, of course, that's on the forefront of his mind when you're talking about any potential tax cut proposals for the next session. Again, it's all going to depend on how the money lines up, how much we've got with growth. We do have some positive growth numbers that led to this surplus. It'll depend on where that Medicaid shortfall is. It'll depend on education adequacy needs. There's a lot of factors to look at, but if he sees the window to do that and do it responsibly, sure, he'll be looking at that.
Let's talk about Medicaid. With the health care ruling coming down, there has been an option for states to not participate in the Medicaid expansion under the federal health care law. Several GOP legislators and elected officials said that this is the option that they want to pursue, to not have health care fully implemented in the state of Arkansas. The governor said it would take a pretty dang strong argument for him to not go forward with the Medicaid.
Is darn strong or dang strong? It's one of those, yes.
Well, to go forward with the Medicaid expansion. So has he heard that argument yet to keep him from moving forward? Is he prepared to go forward?
He's not heard that argument to this point. His big concern, and the one he wants answered by the federal government, is once this gets fully implemented, if something happens in Arkansas, if we have some sort of economic calamity, are we locked in at the level that we're at, or can you scale things back to deal with whatever arises in the state? He before has said he has some concerns about what the additional burden may be on the ongoing Medicaid budget in Arkansas. There are some more offsets that are becoming apparent, and that, we will see how much that really will be. But it is a very good deal financially. It's a chance to get up to 250,000 additional Arkansans insured, take that burden off of uncompensated care and off of the rest of us who pay health insurance. So it is a very appealing possibility, but still, he wants to get some answers from the federal government and see if that flexibility is there for the state if we need it down the line.
So if the flexibility is there, will that be a compelling enough argument for him to say, let's go forward with this, even though there is pretty strong Republican opposition to it?
Well, it depends what else will come out between now and then, but that is the biggest hindrance that I see between him wanting to go forward with implementation, because, again, with this expansion, you're looking at a very good deal financially, completely paid for by the federal government for the first 3 years. And if we don't go forward with this, we're still paying tax money to the federal government for this program. It's just going to go to other states, and he'd rather, as he says, get that money here and not in New York or California.
Is there going to be any effort to work with these Republican legislators who are opposed to this at this point in time to try to convince them this is a good financial deal for the state of Arkansas?
Absolutely. The governor said at a news conference earlier this week he's going to make our Medicaid officials available for any questions that either individual legislators have or that committees have. He wants to make sure that they're getting all the information that we have, getting the best information possible, and getting the full picture about what this means going forward, not only with Medicaid expansion, but with the entire implementation of the Affordable Care Act, because it is a very complex law and is going to have a lot of components to it.
All right, quick question to wrap this up. Does this issue become a defining issue in the fall elections, the difference between Republicans and Democrats in terms of what's good for the state of Arkansas?
It's a good question. There's a lot of polls, I think, in both directions out there right now. There's some that say that people are still very fired up about this issue and have strong opinions one way or the other, but you also have the Kaiser Family Foundation poll that came out this week that says more than half of the people they polled said we think the Supreme Court has decided this case. We're ready to talk about other things like the economy and like jobs and the issues that people really have thought that the election will center around. So we'll see where things go. Our job is to get the best and most accurate information out to people, whether they're legislators, whether they're regular Arkansans, whether they're healthcare providers, whether they're small business owners, to make sure people get the full understanding of what's really going on.
All right, Matt DeCample, Communications Director for Governor Mike Beebe. Thank you for being with us.
Anytime.